Good evening, everyone. We're going to give folks just another couple of minutes here to join. We'll get started in just a moment. All right. Well, good evening. My name is Michelle Marshall, and I'm the Assistant Vice President for Oncology Services. And on behalf of Inspira Health, I'd like to welcome you to our oncology webinar this evening, Cancer and COVID-19, Navigating Your Cancer Journey During Coronavirus. Before we get started, I'd like to cover some housekeeping items. First of all, just a note that this webinar and panel discussion is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Now, regarding our virtual format, you may know this already, but we cannot see or hear you. The audio and video that is turned on right now is only for our panelists. But that being said, we want to make this interactive, and we encourage you to participate by asking questions. On your screen, you'll see a box labeled Q&A. Feel free to submit your questions throughout the presentation, and we'll address as many of them as possible at the end. Your questions will only be visible to our panelists, and if you'd like to keep your identity anonymous, you can do that simply by checking the box that says anonymous before you submit your question. Finally, you'll receive an email after this event with a recording of the webinar tonight. So with those logistics out of the way, let's get started. We recognize that cancer hasn't stopped during this pandemic, and neither have we. Despite the challenging circumstances that we faced, Inspira remains committed to our cancer patients. And although it's far from business as usual, we're continuing to diagnose and treat cancer every day. We're fortunate tonight to be joined by a panel of experts who will elaborate on the current state of cancer care here at Inspira, what's changed and what stayed the same, how we're using technology to supplement traditional healthcare experience, and how we continue to keep your health and safety at the forefront of all of our efforts. Before we get started with our discussion, I'd like to introduce you to our panel tonight. First of all, allow me to introduce Dr. Nandini Kulkarni. Dr. Kulkarni is a surgical oncologist and the medical director of Inspira's Surgical Oncology Program. She's a member of Inspira Medical Group. Dr. Kulkarni completed her full medical school training, including residency and fellowship at premier academic institutions in India. Upon moving to the United States, she then completed a second residency and fellowship with a surgical residency at Abington Memorial Hospital, followed by a fellowship at Fox Chase Cancer Center, where she focused on complex general surgical oncology. She's double board certified in general surgery, as well as complex general surgical oncology. Dr. Kulkarni specializes in breast cancer, as well as the management of melanoma and other skin cancers, liver and pancreatic resections, gastric and colorectal resections, and soft tissue sarcoma. With over 12 years of surgical training and more than 2,000 surgeries performed, she combines her passion for learning and research with genuine regard for improving the lives and experience of patients suffering from cancer. Thanks for joining us tonight, Dr. Kulkarni.
Thanks for having me, Michelle.
Next, I'd like to introduce Dr. Benjamin Nagin, a hematologist and medical oncologist with Southern Oncology Hematology Associates in Vineland. He and his colleagues provide leadership for the Inspira Vineland Cancer Program. Dr. Nagin has been providing cancer care to residents of South Jersey for over 10 years. He completed his medical degree at Yale University, his internal medicine residency at Beth Israel Deaconess, a training hospital of Harvard University. He then completed his fellowship in hematology and oncology at Fox Chase Cancer Center in Philadelphia. Dr. Nagin is passionate not only about working with patients who have blood or cancer-related disorders, but also committed to improving the overall healthcare system for the population of South Jersey. He's served in a variety of leadership roles at Inspira, and he's currently the treasurer of our medical executive committee at Inspira Vineland. Dr. Nagin, thank you for your participation tonight.
Thanks for having me, Michelle. I really appreciate it.
And rounding out our panel this evening is Dr. Tubb. Medical Director of the Oncology Program at Inspira Medical Center, Mullica Hill, and a member of our Inspira Medical Group. Dr. Tubb is triple board certified in internal medicine, medical oncology, and hematology. He received his medical degree from Thomas Jefferson Medical College and completed both his residency in internal medicine and his fellowship in hematology oncology at Thomas Jefferson University Hospital. Prior to joining us here at Inspira, Dr. Tubb served as the chief of the Hem/Onc division, as well as chair of medicine and a clinical trials principal investigator at St. Francis Hospital in Wilmington, Delaware. Dr. Tubb believes in providing patient-centered care with an emphasis on using the latest therapeutic interventions to improve outcomes, quality of life for his patients. Dr. Tubb, thank you as well for being part of our panel tonight.
Thank you, Michelle.
So let's start with a general conversation about COVID-19. It's safe to say that it's really changed our world, not only the delivery of healthcare, but so many aspects of our lives look very different today than they did just a few short months ago. And I think it's safe to say as well that this rapid pace of change and continued uncertainty has created a lot of stress and anxiety for many of us. So let's start this talk by talking about you. How have you been dealing with the stress of the pandemic? Have you found any particular resources that are very helpful or taken up some new hobbies? Dr. Kulkarni, let's check in with you first. How are you doing?
Yeah, it's been a very interesting and illuminating experience navigating through this pandemic. I have two children, 12 and 9, and it's been wonderful to see them adapt to this new situation. You know, they went to regular school and then to online school, it seemed like the next day. And for them, it was just like turning a light switch on. You know, there were certainly hiccups, but their ability to adapt has been inspiring at a personal level. I do love the amount of time I get to spend with my family in this new circumstance, probably more in the last 3 months than I've spent in the last 15 years of my marriage. You know, as far as hobbies are concerned, I love reading, I love biking, and I've taken up gardening as a new hobby and exercise. Just finished digging a trench for some rose bushes, and I can tell you my back doesn't like me very much right now.
Dr. Tubb, how about you?
Yeah, I agree. This is a really difficult time for many, and yet as Dr. Kulkarni has pointed out, it's helped us kind of reconnect with our family, reconnect with our yards. I've also started gardening, mostly pulling out weeds. I haven't gotten yet to planting anything. But I really feel that it's also shown us that banding together as a family, as a community, really helps get through these difficult times. My kids have had a difficult time adjusting as well. I have an older child who's 11. She's doing really well. But my two younger twins, who are 6, have a difficult time understanding that under certain circumstances, we want them to look at the screen, and under other circumstances, we want them to limit time with the screen. So that's been a challenge. But I think that all of us at Inspira, all of us in this community have come together to really revolutionize the way care is provided and also improve access for patients to reach us during these difficult times.
Thank you. Kids seems to be a common theme. Dr. Nagin, I know you've got 2 boys as well, so love to hear how they're doing and how you've been dealing with this.
So it's been a transition. I think that if you would tell me the way we've been able to change everything so quickly and how this new normal has been hitting us so quickly, I would have never thought it was possible. I think we're very lucky in that the team in my practice, the team with administration, we've been able to handle the transition. I've also been lucky that my team at home, we've also been able to handle the transition. My boys have been doing very well. Happily, they're old enough to understand this. But I have to say, while these are, certainly dark times, the fact that I get to be outside more with them, I get to have more family dinners. A lot of the meetings now are at home, so I'm not stuck in the hospital, in an office. That certainly improved my quality of life in some ways and helped us cope with the added stress of our clinical responsibilities.
So it's great to just use that as kind of a touch point for us. And thank you for sharing how you've been dealing with this and how you and your families are adjusting and identifying ways to find a silver lining in the unfortunate circumstances that we've been experiencing. So with that as background, let's dive into our program this evening and start with a fundamental question. Are cancer patients more likely to get COVID simply because they have cancer? Dr. Tubb, can you share some thoughts on that?
Yeah, I mean, I understand that concern. Many patients have asked me this question. Certainly, as many types of cancers as there are present the same amount of differences between patients. So certainly some cancers that require treatments that may impair the immune system, or some cancers that affect the immune system may put those patients at a particularly higher risk for developing COVID infections. On the other hand, some other cancers that do not cause the immune system to be suppressed, or their treatments do not cause the immune system to be suppressed, are less likely to put a patient at risk. So I think it's really important to discuss that directly with your doctor, whether it's your primary doctor or your cancer specialist. They will be able to know which set of criteria you fit. I think the main message, though, is for anyone that has a cancer diagnosis, the difficulty in recovering from the infection is across the board. And I think that underscores the need for making sure that we try to prevent the infection in the first place with the guidance of social distancing, for washing your hands, for not touching your face without first disinfecting your hands, whether that's with soap and water or whether that's with alcohol-based gel that is approved for cleansing your hands. I think making sure that you avoid an infection is the most important thing. And then for those patients that do develop infections, know that our specialists are here to help and get you through that infection as best you can.
Well, that's very helpful for us as a baseline. So let's talk about cancer treatment. As I shared in my opening remarks, as we all know, cancer is still happening and treatment is still happening. So let's start with Dr. Kulkarni for some thoughts on how cancer treatment looks from a surgical perspective these days.
Sure, Michelle. So as you know, South Jersey, New Jersey as a state was hit very hard, and South Jersey took quite a pounding, a little bit behind the rest of North Jersey. So we have just recently experienced a surge, and we're kind of coming to a plateau right now. When we were at the surge, as people are well aware, the governor had issued very strict guidance about elective surgeries not being performed. Now, cancer doesn't necessarily fall under an elective category, but all the same, we had to stratify the risk of performing a surgery in a cancer patient while we had a COVID-19 surge, as opposed to treating them with other sorts of treatment options, such as chemotherapy or endocrine therapy, which is a hormone blocking therapy in breast cancer, for example. And I think our surgical societies did a great job of coming up with guidelines at very short notice for this situation. And we were able to triage patients into those who absolutely had to have surgery, those patients who could receive other types of treatment, such as chemotherapy or the endocrine therapy. And we were able to kind of make sure that our cancer patients did not have a lapse in treatment. It is really important to underscore the fact that if you get chemotherapy before your surgery, that is not an absence of treatment, that is a different modality of treatment. And as you are probably well aware, usually chemotherapy, radiation, and surgery, these form the pillars of treatment. And of course, there's immunotherapy and other types of targeted therapy as well. So all of these are used in conjunction, and the sequence in which they are used sometimes needs to be altered. And that's what we did in this situation. Again, as you're aware right now, the operating rooms are being allowed to admit elective patients. So now we have entered the next phase of reopening. And I think Inspira has done a wonderful job of staying well ahead of the curve in that planning. We have our surgical patients stratified and they are being brought in now as per their risk stratification. It would be great to hear from Dr. Nagin as to, how these alternative treatments have worked for our cancer patients.
So we've been able to keep the infusion room and the other portions of the cancer treatment center going without really losing much. And I could personally think of not a single patient from our perspective that care was majorly interrupted. It may have been reordered. And the ways that we've been handling that is we've been limiting visits, and we and Inspira have expanded telehealth visits, allowing the patients to stay away from medical institutions. We've been able to fax lab slips, even get home labs in some situations, and limit the number of people in the office. So by doing the telehealth, not only are we avoiding the patient's risk to the office, we're avoiding the office risk to the patient. We have been working closely with our surgical and radiation colleagues that maybe you're in a situation where you need surgery then chemo. We may do the chemo first and then the surgery because the OR room is not available as of yet. And of course, this was all done on the fly, which made it even more exciting, but we have had very good information given from our governing societies, such as the American Society of Clinical Oncology and the National Comprehensive Cancer Network, which we follow very closely. And we did have an enormous amount of support from our administration. We also equipped the office with face shields, temperature checks. We limited visitors to make as safe of an environment as possible. And to this extent, we've done a pretty good job at avoiding the morbidity in our patients.
Yeah, you touch on the safety measures, and we're going to circle back to those here in a little bit. But for right now, let's stick on that topic of treatment. And the next question I would have if I were a cancer patient is, what happens if I catch COVID while I'm in the middle of treatment? What then? Dr. Tubb, can you talk a little bit about that scenario?
Yeah, obviously that's a scenario that a lot of patients are worried about when they're contemplating starting the treatment. That's one of the potential risks that needs to be discussed up front. But as I mentioned earlier, there are some treatments that we give that do not necessarily reduce one's ability to fight an infection. In general, the consensus is that if you are shown to have an infection and you have not yet started your treatment, you ought to postpone your treatment. That's certainly a discussion that needs to happen between your doctor and yourself. Some treatments may be postponed for a shorter amount of time. Some treatments may need to be postponed for a longer amount of time. And understanding where you are in that infection timeline is really important. I think that the other important thing to note is that if you were to get the infection, we have very effective supportive medications now that are helping people get through their infection. We'll talk about that a little bit later, but there are treatments that involve the use of plasma from people that have recovered, the use of antiviral medications that can help you get through the infection more effectively. And I think that that is really important to bring up to your practicing oncologist. We've been screening all of our patients now, whether they have symptoms or not, to make sure that we do not start a treatment at the wrong period, to make sure that patients get through their treatment safely. Another question that's been asked is it safe to come into the hospital, to come into the infusion center, to come into the office or the operating room to get these treatments in the first place if others have been through with the infection? And a study was done out of a collaborative new center demonstrating that after checking 180 spots in the hospital, they found no evidence of infection or infectious material on areas such as door handles or desks or waiting room chairs. And they did this study without informing people that they were going to do the study. So I think this reflects the very strong and very effective nature of our cleaning techniques under normal circumstances. And under these circumstances, they have certainly been heightened. So the answer is yes, it is safe to come in to see your doctor if you need to. In other instances, as Dr. Nagin alluded to, we will use telehealth or telephonic communication to reduce traffic.
So, Dr. Kulkarni, is the answer similar from a surgical perspective if you have a patient that's planned for surgery who ends up coming down as COVID positive?
Yeah, absolutely. I agree with Dr. Tubb. You know, there is definitely a risk stratification that needs to be taken into account. Obviously, if your surgery is not urgent in the sense that there is no downside to waiting a few weeks before doing your surgery and you come back COVID positive, the safest thing to do for you in that infective phase is to wait. Of course, you know, not everything comes under a blanket recommendation. So if based on your surgical stratification, it is an urgent procedure or even an emergent procedure, then we will take the appropriate precautions in the operating room. At Inspira, we have designated operating rooms for COVID positive patients that have all the special equipment and negative pressure areas that are required, and all the necessary personal protective equipment, or PPE as we say, is available to the providers if we had to do surgery on a COVID positive patient. And in fact, we have been doing that very successfully throughout this pandemic.
We can definitely say that the presence of COVID has changed many of our practices and driven us to innovation. And we've alluded to some of this innovation already. So let's tackle one of these. And a change that we've made at the hospital, many of our practices, I know all of the practices for the panelists tonight, is the rapid adoption of technology, and in particular, telemedicine. That's really enabled us to continue delivering care in a safe environment, maintaining social distancing. So Dr. Nagin, tell us a little bit more about how you've implemented telehealth at your practice and what that experience has been.
So that's been a huge benefit because, as I said before, it's a twofold benefit. Number one, the patient's not going out of their home, and so they're safer. And number two, by reducing the traffic in the practice, we're making the cancer center safer as a whole. It's actually been surprisingly successful, and I think the patients absolutely love it. I think it's something that's probably going to stick with us long after this crisis goes away. Especially many of our patients are sick. Many of our patients have limited mobility. Many of our patients have limited transportation. And so even if it's not all of your visits, if I can make half of your visits where you don't have to come in and you don't need to see me. Also, we've had a few acute visits where a patient shows me their arm, shows me their rash, and that's really been able to have me make a good clinical decision for them. We want to be very clear, both at my practice as well as I'm sure all of my colleagues, that if you do need to be seen by a doctor and it has to be in person, our doors are still open for you. But it's just that we are giving patients this option. And as far as I'm concerned, and as far as I've been told, about 95% of the patients who are given the option are taking it. We also do have availability technology for patients who don't have a smartphone, which some of our patients have, to do the telephone visit as an audio only visit. And that obviously you're missing a little bit of the video, a little bit of the ability to do a physical exam, but we are still able to take care of these patients. And then if there is a problem that we need to escalate, we do welcome them into our practice.
And Dr. Tubb, I think we're using technology and telehealth concept in an inpatient setting as well, too. Have you had experience with patients, especially as we've had to limit some visitors on the inpatient side?
Yeah, Michelle, as you know, several months ago, we were looking at how we can improve the use of our technology for not only patients in the hospital, but this was before COVID, how we can help bring patients and their families together during the office consultation. Say your sister lives in a state that is not easily traveled from to and wants to be part of your consultation, we wanted to try to ramp that up over the next several months. Well, it happened literally in a week, or in some cases overnight, using that same technology that's been available here at Inspira for many years, just not utilized on a regular basis. So yes, I do use video technology when I go to the hospital to make rounds. I think that it helps bring the family member into the care area. It helps to reassure them that they can, that their loved one is being cared for. It also provides some relief for the patient that is unable to leave, unable to see their loved ones in many circumstances because of the reduction in visitations both to the hospital and to the outpatient center. So it has a therapeutic benefit, it has a connectivity benefit, and it helps patients and their family have better access to our center. The other important thing is that we want to make sure that our patients know that we're here for them and that we're caring for them in the same environment. And so to Dr. Nagin's point, when we do telehealth visits, it's reassuring for them to see you in the environment they're used to seeing you in. In other words, being in the office or being in an exam room in certain circumstances where it applies can be reassuring to the patient to know that, okay, the whole world has changed in many respects, but my care is going to remain the top-notch care that people are expecting from our practices.
That's great. It really sounds like telehealth has been a game changer and a lifesaver in some regards for us as we've had to rapidly adjust to these new circumstances. So safety is another topic that I really want us to cover. We know that social distancing measures have been shown to have a very positive impact on the spread of COVID. Telehealth is one way that Inspira has shown our commitment to safety by implementing that. But safety and really the safety of not only our patients, but their families and our staff and our physicians is really paramount. So I'd like to spend a little bit of time hearing from you on some of the things you've done in your practice and what we've been doing and you've been experiencing here at Inspira related to changes we're making with safety in mind that are keeping all of our constituents safe. Dr. Kulkarni, can you start us off?
Sure. So as you mentioned, and Dr. Tubb and Dr. Nagin have alluded to in their comments earlier, the paramount point is that we want to continue to deliver the same quality of care with adequate safety in mind, but without making the patient uncomfortable about the situation. So in order to do that, we kind of start screening at multiple levels. So when the patient first calls for an appointment, there are some screening questions that are asked, and these are adherent to whatever have been the current CDC guidelines. So screening questions such as, are you having any cough or shortness of breath or fevers? Have you been traveling recently? Things like that. Are you exposed to a patient who's been diagnosed as COVID positive? And some of these screening questions are basically asked with the intent of trying to figure out if the patient who's coming in is at risk for COVID-19 infection or not. This question does get asked again when the call goes back to confirm their appointment, once again on the day of the appointment. So at the cost of being a little bit annoying, we are trying to make sure that the question is asked repeatedly, for the simple reason sometimes patients are unsure how to answer, or there are older patients who don't quite understand the question. And so the fact that we ask it repeatedly adds layers to making sure that the right questions are being asked, the right screening is performed. So in my practice, for example, once they have passed these screening questions, the patient is asked to wait in the car when they come for the appointment and give us a call as soon as they arrive. And that acts as the physical check-in, just like you would if you walked into the receptionist's desk. Once we are ready for them, the patient is brought upstairs. At the entrance of the office, once again, they're asked the screening questions, and basically a temperature check is performed. All my staff is masked. We expect that the patients come in with their own mask too, whether it's a cloth mask or a regular mask. And when they come in, they are taken directly to the room that they will be seen and examined in. So basically what we do is we eliminate their time in the waiting room. So that way they're not, first of all, there's not more than one patient at a time in the waiting room. And the amount of time that they spend in that waiting room is minimal. Once they're taken back to the room, once again, all the vital signs are taken. I go in and I talk to them. Again, I'm wearing a mask throughout the interview. And when I'm examining the patient, I'm using appropriate gloves and, PPE as needed. It is critical to understand that we are doing this in order to safeguard the patients and also safeguard the caregivers. In no way, shape, or form is this meant to be an exclusion criteria. So what I would like to emphasize is that even if you were to answer yes to any of these screening questions, the intent is to make sure that the care that is delivered afterwards is done so with the appropriate precautions in mind. So we would never turn away such a patient, even if you had symptoms. If you needed to come into the office, we would definitely get you in, see you with the appropriate PPE. And if the symptoms were significant enough, we would be able to direct you to potentially additional testing, or even if it were that bad, maybe even to the emergency room if you needed to be taken care of directly. So we are here for you. I think that should be the pervasive message, and all adequate precautions that need to be taken in order to see the patients safely will be taken.
Dr. Tubb, what's been your experience with some of the changes that you've seen related to safety?
Yeah, so as you know, also early on at Mullica Hill, we were looking not only to the CDC, but looking ahead of the CDC to try to find ways to minimize exposure, both for our healthcare workers and for our patients that come into our center. So we made several changes to limit access points in terms of which doors you can come into the center without impairing the convenience for patients. I think that's important. We instituted an early adoption of everybody wearing masks. At the beginning, the CDC wasn't sure. They weren't saying to do it or not to do it. But after reviewing our inventory and discussing the appropriate and most effective way to keep our patients safe, we as a medical community, but also along with our administrators, decided that all patients coming into the center should be wearing masks, all physicians should be wearing masks, and the type of masks that you use will depend also on identifying people that are higher risk or that have been diagnosed with COVID. So that goes back to the importance of those questions. They're not designed to discriminate. They're designed to make sure and to inform not only the medical community, but also patients and their families how best to protect themselves and their loved ones. I think that another important thing was to make sure that, you may not realize that you're sick. You may not feel ill. We've heard of these cases of patients that get through the infection with minimal symptoms and in some cases no symptoms. So doing things like temperature screenings at the point of entry, temperature screening when you get upstairs, temperature screening when you get in the room. We've always said vital signs are vital, and that certainly is true in this case. At certain areas where patients from the community have to interact with staff to protect both the patient and to protect the staff, we've had some barrier protections such as plexiglass that, again, doesn't limit your ability to kind of communicate well and effectively with the other person, but does provide an extra layer of safety. And lastly, as I alluded to earlier, hand hygiene really is one of the most important things that all can do to protect themselves from this infection. In the medical field, we've all known for a long time that washing your hands helps, and most of us do it multiple times in a short period of time. Using a disinfecting gel also helps. So Inspira has installed these so-called hand hygiene stations all over the hospital in greater numbers than they were even present when the hospital was built. And I can tell you that the hospital is really well designed and has these all over the place, but now they're even more accessible, before a door, after a door, if you have to touch the door, before a elevator, after the elevator. And I encourage everyone coming in and out of the center to do that and to think about that when they navigate through their daily lives.
Dr. Nagin, how about changes that you may have experienced in your practice or that you've seen related to safety?
So I think that I have to agree with my colleagues in all those same things. I mean, no one intervention is going to be 100%. But when you start layering on, and interestingly enough, it's the low tech things that work best. Washing your hands, wearing a mask. These are things that are not expensive. These are things that are not questionnaires. But these are things that when they have to be consistent. And I think the current consistent reinforcement and a culture of safety where, if someone feels that, hey, you forgot to wash your hands, you're not wearing a mask, that up and down the chain, that's something that's been very stressed at Inspira, that, hey, if a nurse sees a doctor without a mask, you're going to say, hey, let me get you a mask. Someone sees someone not washing their hands, it's not a top down, it's everyone's in the same boat to make sure that consistency and make sure there's as many layers as possible to keep both the patients as well as the staff safe through this crisis.
So while our commitment to providing and delivering cancer care hasn't changed, it is safe to say the physical environment and the experience that you have might look and feel a little bit different. And that is quite an extensive list of changes across practices, across institutions that have been made, really all with the goal of safety in mind. And I think it's safe to say, Ben, you kind of alluded to this too, I don't think they're going away. As things start to reopen and folks start to be out more interacting with the general community and coming in to see us, these things will continue. So let's actually shift gears a little bit. We talk about people re-engaging with us and talk a little bit about cancer prevention and in particular cancer screening. So things like mammograms or colonoscopies or low-dose CT scans for lung cancer, you could view these as elective procedures. So during the acute phase of the pandemic, we saw a large number of people who would typically be coming in for these services decide that they were going to stay home. But as we've talked through the safety measures that are in place, as we start to see people being encouraged almost even to go back out and start to re-engage, I think it's a good time for us to ask the question, is it time for patients to start to think about these screenings or is it too soon? And Dr. Kulkarni, I'd love to hear your perspective on that.
Yeah, that's a great question, Michelle, and I'm sure one that a lot of our patients and folks that are watching us today are probably wondering. We in South Jersey especially have certainly achieved the flattening of the curve at this point. I would say it's safe to say our new infection rate has been consistently low for the past several days now. As you know, once again, the governor has reopened, we just heard today, the phase 2 in terms of general businesses. And that begs the question, so do I go out and get my colonoscopy now or should I go out and get my mammogram? And I do think that, what in all this conversation that we've had, the point that needs to be underlined is that this is the new normal. And so if this is the new normal, then it's time to do all the things that you would do normally, just with the added precautions that we have been talking about throughout this, this topic. Mammograms, colonoscopies, screenings for skin cancers, low-dose CTs, as you mentioned, these modalities have been known to save lives. It has been shown that the earlier you detect a cancer, the better your long-term prognosis is, the better chances for a cure in a lot of these situations. And so pushing these off indefinitely is not going to solve the problem. You just trade one problem for another. as we move out, we did the right thing by sheltering inside for so long. And now as we move out, we are going to move out in a pragmatic way. We are going to take the right precautions. And when you come into Inspira for these screenings, Inspira has taken extraordinary measures when it comes to putting the patient's safety foremost. So as Dr. Nagin, Dr. Tubb have outlined before, all the safety stations that have been installed in the hospital, waiting rooms. If you even look at the radiology waiting room, for example, there's the chairs have been removed to ensure that there's 6 feet distancing. There are stamps where you need to wait 6 feet apart so that you're not too close to each other. The imaging centers have taken excellent precautions to make sure that there is adequate decontamination happening in between two patients. Appointments are being given accordingly. Patients who are coming in for procedures are being given very explicit instructions on when to arrive, what to do. Patients do get COVID testing if they're coming in for elective procedures, such as screening colonoscopies or elective surgeries. And so overall, I think, if you were to venture out now and come to the hospital, you are probably coming into a very safe environment, probably safer than going to the grocery store.
I think that's really helpful guidance. And as someone who's sitting on a screening script and I've been putting it off, I guess you're telling me it's time to call and make the appointment. So I'm noting that as my own personal call to action. So let me shift gears just a little bit, because another aspect of cancer care is clinical trials. And while it's not relevant for every cancer patient, for some, clinical trials are really the backbone of their treatment. So Dr. Tubb, are we still offering clinical trials here during the pandemic, or have those stopped?
No, that's a great question, Michelle. They have not stopped. Clinical trials, as you mentioned, in some cases is the lifeline for certain patients, and certainly for the medical community, understanding these challenging times better to help future patients get through not only COVID, but through a potential difficult treatment is imperative. As you know, many of the trials that we've been conducting over the past several years have shifted from chemotherapeutic trials to using your body's own immune system, so-called immunotherapy trials, to reduce not only the impact of the treatment, meaning side effects, to avoid side effects from chemotherapy, but also to improve a patient's longevity, their life, improve their quality of life. And so that continues during COVID. For example, I mentioned this earlier, and Dr. Nagin will address this. We've opened several clinical trials across the system at Inspira at multiple hospitals to try to treat these COVID patients with newer and emerging therapies that have been shown to be effective in other parts of the country. In a way, we were lucky. Our wave came a little bit later than Northern Jersey and New York and some other areas. And the experience that we've been able to glean from those areas and talking to those experts has allowed us to open clinical trials here at Inspira that specifically help to get patients through these infections, but also gather the information to make sure that we can understand this better after we've passed the wave, to look back and reflect on what was the most effective treatment and which treatments should not be done again.
Dr. Nagin, can you tell us a bit about the clinical trials that we're doing that are specific to the COVID epidemic?
So yeah, we have 2 great clinical trials that are currently open. The one clinical trial, which I've been a big part of, is what's called the convalescent plasma program. So this is where we take the plasma from a recovered patient. This is essentially a blood product. You donate blood just like you would normally donate blood. And this is a patient who's recovered from the virus. We process that safely through the Red Cross, just like a normal blood product. And then we give it to patients who are suffering and ill from the COVID virus infection. We were one of the first sites in the country on this. We were in the first 50 that were doing it. And we were one of the first 2 in South Jersey to do it. To this date, we've transfused about 60 units of plasma into patients, and we've recruited about 90 patients on trial. We've also been able to provide an enormous amount of plasma to the system to make sure that patients both within the Inspira system and throughout the country have access to this precious product. We've also been early in the distribution of a new drug called remdesivir. This is an intravenous drug given for patients who are very ill with COVID. And we've given a number of patients this medication as part of an ongoing clinical trial and collaboration with the drug company that produces this drug. It's too early to tell exactly what the results of this is. And as I said, we're part of a national trial, but we are submitting the data and we're looking forward to giving our patient every chance they could get.
I appreciate you guys sharing that information. Really another example of innovation right here in our own backyard. And I want to thank all of you for your involvement in clinical trials and your leadership in bringing these types of trials to Inspira. It's really great to be able to offer this to our patients. So with that said, this actually concludes the formal part of our panel discussion this evening, but we do have some questions that have been coming in. So I'm going to pull those up here, test out my IT skills as I try to navigate through the questions. So let me just take a look here. So Dr. Kulkarni, question for you. Are the rest of the cancer support team still working? We obviously know our med-oncs and our surgical oncologists are because you're here with us tonight, but what about folks like social workers and navigators? Are they still involved in care?
Oh, absolutely. So, nobody's really taken a break from work in Inspira. We have just redesignated roles to, people who can work from home, support from home. We've encouraged that kind of situation. So yes, absolutely. Our social workers are available. Our nurse navigators are available. And in fact, in just this last week, our nurse navigator has also come back to the role of in-person visits. So if you come to the office, she will be available to meet with you personally. And it's a great form of support. It's a great form of troubleshooting. So if you are having issues navigating between appointments, if you're having issues coming to the cancer center, we have resources that are very much available and ready to take your call and help you navigate through this process.
Great, thank you. Here's one that circles back to telemedicine. Dr. Tubb, maybe you can take this one just for your opinion. As patients start to come back to your office, do you think telemedicine and virtual visits will go away, or do you think that's going to become a part of our new normal?
I don't think it's going to go away, and I think that I'm happy it's not going to go away. I think that what we've tried to do at Inspira, not only in the multiple sites that are available for patients to have access to their care, the multiple primary care sites, the multiple urgent care sites, the multiple large hospital sites, some new and some recently updated, all speak to the need for more access. Patients need to be able to get in to be seen, or at least have a way to contact their primary care doctor, their specialist, their nurse navigator, their social worker, the finance company, or even the medical records. And so I think that this opens up an opportunity to really use a new technology to be able to do those things. The old way of coming in and sitting in the waiting room for several hours hopefully is gone, and hopefully we can harness this technology to continue to provide that access for patients that need to have a 5-minute question that may not need to drive half of an hour or 20 minutes and park and then come upstairs, when that could be answered much more quickly through telehealth. So I've really seen that this tool is really very beneficial, not only to providers, because it allows us to do and to provide this care in areas that we weren't previously able to do it, but also for patients. And so I see it really coming together and being part of a patient's experience with their doctor. And as Dr. Nagin alluded to, you don't need the latest and greatest gadgets to be able to communicate with your doctor. You don't need a fancy phone or a fancy computer. Oftentimes we can do some of these visits with a landline. We can do them with other technology if need be. So that's a really important part of the future. And I'm really happy that at Inspira we're able to get this up and running, like I said, virtually overnight.
That's great. Thank you for that. Here's another question that's come in. Dr. Nagin, maybe you can take this one. Are there any immune boosting strategies that cancer patients should be considering right now to try to stay healthy?
Yeah, that's an excellent question. So when it comes down to it, what we're realizing about this virus, which is actually true about most illnesses, but really true about the coronavirus, is that sicker people and older people have a difficult time. Of course, you're not going to be able to change your age, but you can affect your other risk factors. So the big risk factors we're seeing, number one, which is going to be my number one always, is don't smoke. This is respiratory virus. So anything you could do to preserve the function of your lungs, when you stop smoking, the benefits start happening within 6 hours of that last cigarette. So stop smoking. That's the number one thing you're going to do. Healthy diet with lots of fruits and vegetables, getting those vitamins, especially the vitamins within the foods as opposed to pills. That's going to make your immune system stronger, and being outside and exercising. And it's been very clear that patients who are smokers, they're going to fare worse. Patients who are overweight, they're going to get worse. And the obviously the more, so not that you need to be a size 0, but if you could get slightly less weight, that's less pressure on the lungs, that's less pressure on the heart, and that's going to make you fare better, getting that heart and lung working better. So it's not like there's a secret pill you could take, but it's more of all the healthy lifestyles. But those things, again, low tech, very straightforward, not necessarily easy, but those are things that really do improve mortality and morbidity with this disease.
It's all the things Grandma told us to do.
Mm-hmm.
Grandma was smart.
Yeah.
So here's actually sort of the flip side of that question. And I'm not sure, maybe Dr. Tubb, you want to take this one. Are there any medications that make cancer patients more susceptible to COVID?
Yeah, I mean, certainly some of the treatments that we offer patients with certain cancers can make them more likely to have a difficult course through the infection. The likelihood of contracting the illness is similar. It is introduced either through droplets coming from somebody else into your face or to your eyes. It's introduced by touching a contaminated surface and then touching your face or your eyes. And that applies both to patients with and without cancer. So again, going back to what we talked about earlier, protecting your face, protecting your eyes, disinfecting your hands, staying away from large crowds is certainly good advice if you're receiving treatment for cancer. I do think, going back to what I said earlier as well, this is really important to discuss with your physician. There are so many different potential medications that we would be talking about. There are so many different circumstances. Somebody may have cancer and an immune disorder, or they may have heart disease and cancer, or they may have pulmonary disease and cancer. And certainly all of those things add a layer of complexity, and discussing it right now one by one would be not to the benefit of everyone listening. So I encourage you to have this discussion. We are all available to consult for anyone that has questions about it. We're open, we're available. We've really tried to make sure that patients can get care in their own backyard in South Jersey at Inspira locations that are literally, if you look at a map, almost everywhere in this area.
Thank you for that. We actually have a question here related to the plasma trial. So Dr. Nagin, maybe you want to take this one. How can we donate plasma? Do we need a script?
Excellent question. So no, you don't need a script. And you don't necessarily, to be on the clinical trial is for patients who are to receive plasma. To donate plasma is something you could do. Now, the Red Cross will enroll you in the trial, and we are able to forward people to the Red Cross to do the trial. But essentially, if you are a patient who has had a positive COVID test, is symptom-free for 14 days, and then has a negative COVID test, or you're a patient who had a positive COVID test and then has a positive antibody test showing that you've recovered, you will be eligible to donate plasma. The other thing I would tell people is even if you're someone who's never had COVID, sadly, we are running into a blood shortage because all of the normal ways that we are able to donate blood, the blood drives we do, the one we do at my temple, for instance, is shut down because of the crisis. And so this is something that anyone who can donate blood should call the Red Cross and try to donate blood. But the plasma issue, you could just show up, and as long as you are the appropriate patient, you don't need to talk to your doctor. They'll take care of everything. And there is no cost to you.
Really good information and great question. Great to hear that from our community, that folks are looking for a way to be involved and to give back. So we are just about coming up on time, but before we kind of do a final wrap up, I did want to take just a moment to tell you about a service that we're offering for our patients and announce a new partnership that we've launched with Gilda's Club of South Jersey. So Gilda's Club specializes in providing comprehensive support services. And I'm pleased to share, as you can see on the screen, that we are beginning to offer a virtual wellness support group for our cancer patients. It's going to be held every Thursday evening from 6:30 to 7:30. When you get a copy of this presentation after the webinar is over, this slide will be there, so you don't have to write the information down now, but we know that support groups have been shown to be a significant source of strength for a lot of cancer patients. And in these especially challenging times with a lot of uncertainty, we're very excited to be able to offer this new and innovative way for you to connect with other folks who are going through similar experiences, to share your wins, to share your challenges, and to really draw support from each other. So I encourage you to reach out to us if this is something that would be of interest to you. And with that said, I'd like to kind of bring us to a close here. We're just about at 7 p.m. Very much want to thank our panelists tonight. It's been great to hear from you. Thank you so much for taking the time to talk with us tonight. And I think that it's very clear from our discussions that Inspira and our oncologists, our physician team, are really committed to our patients, to our community, providing personalized, cutting-edge treatment in a safe environment. So we thank you, panelists. I thank you for joining me tonight. And for those who are viewing at home, thank you so much for taking the time to view this. We really appreciate your interest in this. Stay safe, stay healthy, and know that we are here if you need us. Have a great night.
Thanks, Michelle.
Thanks,
Thanks,
you.
Michelle. Appreciate it.